Hi, this is Dr. Mark Katz in Tampa, Florida, and I'm going to talk about a topic that's very common in Tampa and in Florida in general, and that's athlete's foot. So a lot of people ask me, what is this athlete's foot? What does it come from? And it comes from a fungal infection. It is a fungal infection. It's not bacterial, it's not viral, it's fungal. Fungal infections are infections of the skin typically. In the case of the foot, they can cause dry scaly skin on the bottom and sides of the feet. They can cause red areas that itch. They can cause irritation between the toes with something called maceration, which is the white skin that develops from the fluid that leaks out. You can get little blisters. These are all different types of athlete's foot, different stages of athlete's foot. And the important thing to know is that this is not the type of condition that can actually, affect the rest of your body or get into your bloodstream, but it's extremely important to treat because the infection in the skin can eventually make its way into the toes and onto the toenail, which makes it very resistant to treat, although we do have great laser options for that these days. But the other thing is, if you have diabetes or poor circulation or other types of autoimmune disease, if you have these infections, they can turn into secondary infections, which are bacterial infections, which are the common infections that we take antibiotics for. So it's really important that you treat athlete's foot and not just let it go. And it's important that certain types of hygiene occur in the shoe, where you spray your shoes to keep anything from regrowing. But don't just let it go. You don't want to have other problems associated, especially if you do have other medical conditions. So if you have this problem and you're not getting relief from the typical over-the-counter treatments, call us at 813-875-0555 in Tampa, or you can check us out on the web at thetampapodiatrist.com. Have a great day.